the Spanish and Portuguese Sisterhood Super Tuesday event. Tonight, we have the honor and pleasure of having Dr. Joanna Singerman. She's a BSc, BVet, Med, MV. She's a veterinarian at the Animal Health Clinic. She graduated and completed her undergraduate studies at McGill in kinesiology. She has a passion to help all animals and works with dogs and cats. She has a particular interest in cardiology and dermatology. This lecture will be about overall pet care and how to deal with common issues in dogs. So without further ado, I'd like to welcome Dr. Joanna Singerman, known to our community as Doris Ambar's granddaughter, lifetime member, and of course, Ellie, and the daughter of
Darlene and Jonathan.
Darlene and Jonathan Singerman. Thank you.
Perfect. So thank you so much, Grace, for having me. So yeah, I work at the Animal Health Clinic on Sherbrooke. And today I'll just be talking about basic care, so vaccines, flea and tick prevention, the most common problems. And yeah, so I hope you all find this useful. Don't fret over your pet. So we'll start with the vaccines. What are vaccines? And basically, what do your pets need to get vaccinated for? So vaccines are the causing virus or bacteria. They have been killed or altered, so they can no longer cause disease, and they stimulate an immune response to protect your dog. It's not 100% protection, but it's very high. And if your pet does get the disease, it will reduce the clinical signs. So we have core versus non-core vaccines. And core vaccines are basically every dog should be vaccinated for these core vaccines. So the base and rabies. And then we have non-core, so leptospirosis, Lyme disease, and bordetella. And it really depends on the dog's lifestyle if they need those ones. So I'll go into detail about both. So the core, so their base, which is called DA2PP, and the rabies. So the base, it contains 4 pathogens, the first one being distemper virus, and then the second being parvovirus, which is the one we really worry about. It's the more common one, and it's spread by infected feces, and they can catch it from the grass, the environment, and it's really serious because 60% of dogs die, even with hospitalization and all the treatments necessary. So this is seen in puppies who are not, they don't have their full vaccines yet when they're younger, and also in older dogs if they're not up to date with their vaccines. And it's really resistant in the environment. It could stay in the environment for a very long time. So it's really important to keep your dog close to your household and don't take them in busy areas. And then it also covers for canine adenovirus too, and parainfluenza, which is a component of kennel cough. So that's the base. And then we have rabies. So rabies is mandatory, and it could be fatal in dogs, and it could be transferred to humans. It's not common at all, but if the dog gets it, they can shed the virus even before clinical signs are seen. And it's basically carried by wildlife outside and even bats in the summer. So especially if you find a bat in your house, you want to make sure that your pet is vaccinated. And it causes neurological signs, and they can become extremely aggressive. And let's say somebody is bit by a dog and reports it to the police, they could actually take your dog away from you if they're not vaccinated for rabies. So those two are really important. And then the non-core. So this really depends on the individual dog, but the first one is leptospirosis. I think this is really important. I always recommend this one. And basically it's leptospirosis, so it's carried by wildlife in their urine. So when they pee in puddles, on snow, in lake water, if the dog goes and drinks from it, which most dogs do when you take them outside, they can get it, and it can cause liver and or kidney failure, and it could actually go from the dog to us. So that's why it's really important to do that one. Then there's Lyme disease, which is caused by the bacteria Borrelia burgdorferi. So it's spread by an infected tick bite. If the tick carries Lyme disease, not all of them do, but if it does, That's how they can get it. So we're seeing more ticks in the Quebec area. So especially up north, eastern townships, and we've seen a lot of cases even in the city area, so even in their backyard. And it affects the kidneys, joints, heart, the nervous system. 90% of the time, even if they are infected with Lyme disease, they don't show any signs, but they can at any point. So it's important, even if they're vaccinated, we want to make sure they're on tick control, and I'll get into that later. And then there's Bordetella bronchicepta, which is the main component of kennel cough. So especially if your dog is going to dog parks or going to doggy daycare, this is important. And kennel cough is, it is quite common, so they could still get it even if they're vaccinated. But it's usually self-resolving anyways. So that's that. So vaccine reactions. So what happens after your dog gets the vaccines? So normally there'll be a bit of soreness at the site of administration, a bit of lethargy, inappetence. So yeah, so they'll be a bit tired. It shouldn't persist, any lethargy or tiredness, for more than a day or two. So allergic reactions are possible from vaccines, but they're quite rare. So, but if they do have an allergic reaction, you will see facial swelling. They could have anaphylaxis, so intense vomiting, diarrhea, breathing issues. So they need to come back right away. This usually happens very, very shortly after the vaccine. So usually within an hour or two, but it is extremely rare. So maternal derived antibodies. So basically antibodies from the mother, yeah, so they provide protection for the first 3 months of life. And a lot of the time, the reason why I'm bringing this up is because a lot of the time you see puppies that are vaccinated very young in order to start socialization. And this is important to bring up because it might not always be effective, the vaccines. So they can still persist. So it's important we follow the guidelines for 3 doses at 8 weeks, 12 weeks, and 16 weeks. And some clinics do 8 weeks and 12 weeks, but we like to make sure it's they're good, so we do at that time. And also rabies should only be done by the 4-month. So yeah. So also if you have a black and tan breed dog, so like a Rottweiler, Doberman, they have poor vaccine responding. So basically it's really important to give them the 3 doses. And obviously keep your dog away from other dogs, parks, areas that are highly populated until they're fully vaccinated 2 weeks after the last dose. So over 16 weeks of age. Food. So what is the best food for your dog? So this is a lot of opinions for food. This is quite a controversial issue because there are so many food options to feed your dog. So I'll go into detail about each one. So the first one you see here is Royal Canine Dental. So that's a grain inclusive, full balance kibble diet. So that's a good one. I really like that one. And then we have grain-free foods. So those are more popular within the last few years. And then there's raw food. And then this is just an example of a home cooked food. Yeah, this is a dog cookbook. So we'll talk about that in a minute. Complete balanced kibble diet. So that's the first category. So they have dry and wet. So this includes grains, carbs, proteins, fats, and it has the right balance of all nutrients. And grain is healthy for all dogs. And they also have, prescription diets as well. So I just listed some diets here. So there's Royal Canine. They have the dental diet, which is great. Royal Canine Development, great for puppies. Then there's Hills, which is a really good diet. So the Science diet's good, and they have multiple prescription diets, especially for older dogs. And if they have issues. And then Purina Pro Plan is good for puppies, and the Essential Care line is really good as well. They're fully nutritious, fully balanced diets for dogs, and dogs are omnivores. So they need nutrients from meats and plant-based food products. So raw food. So raw food has become very popular the last few years. So the thing is, if you want to feed your dog raw food, it has to be a commercial brand. You can't just go to the butcher and get a piece of meat. You can't go to the grocery store and just get a piece of meat because it can contain bones. which can get stuck and be a big issue, and also lack the right amount of proper nutrients, which can lead to deficiencies in your dog. And the big issue with raw food is that it's raw, it's not cooked. So they can still contain pathogens like E. coli, Salmonella, Clostridium, and the dog could actually shed the bacteria and give it to a human in the household. And another thing is the dog could actually have the bacteria and shed the bacteria, but show no clinical signs. So you won't see that the dog is sick. And they can still pass it to human, even if the dog licks your face. So that's important to keep in mind. And especially if you have a household with children or with elder people or people undergoing chemotherapy or any immunocompromised people, I would highly advise not to feed raw because of that risk. And if they get sick, it could be quite detrimental. So we really want to avoid that risk at all costs. And also, I wouldn't feed it in pregnant dogs or puppies because it can have an impact on growth. So if you want to feed raw, make sure it's a commercial brand, and you have to be extremely careful and take all the safety measures to minimize the risk. Keep it in a separate area in your fridge, clean up. You have to be aware of that. Now, grain-free diets. So they've also become more popular the last few years. Because in humans it's quite popular, but there's actually no research, and dogs rarely react to gluten or grain. If they have an allergy to food, it's usually going to be chicken or beef. That's most commonly when they have a food allergy. So they're not obligate carnivores. So grain and carbs, it's actually okay for the dog and a great source of nutrients. So basically, the issue with grain-free food is the last few years, veterinary cardiologists have actually seen a link of dogs eating a grain-free food long-term. Some of them develop, not all, we actually don't know how high the risk is, but there is a link that it's a risk factor. Some dogs develop a type of heart condition. So the heart condition is called dilated cardiomyopathy. It affects the muscle of the heart and can lead to heart failure if we don't do anything or change the diet. So this is diet-related dilated cardiomyopathy. And they can show no clinical signs until later stages. So until we see exercise intolerance, meaning they get tired very fast from exercise, syncope, so they may pass out, faint for a minute or two, and sometimes a murmur is detected on physical exam. So whenever I'm examining a dog and I know they're eating a grain-free food and I hear a murmur, I tell them to switch foods immediately because it's very understudied. We don't know much about it yet. So we don't know the percentage. And we don't even know why this is actually happening. Many dogs who eat grain-free foods are fine. So it's something they're going to be doing studies over the next few years to figure that out. But there was a study done in 2019 which showed 90% of diet-related dilated cardiomyopathy had been on a grain-free diet. And 93% of those foods that were grain-free, the main ingredients were peas, lentils, legumes, and potatoes. And they kind of term it the bag diets because they saw that it's not exclusive to grain-free, it's boutique and exotic proteins as well. So I always like to educate owners on this and leave it up to them, but they have to be aware that there is this link. And personally myself, I have seen a few cases, and the cases that I saw, they were eating a canna, from, origin, and go. So common questions I get from owners are, yeah, my dog's been eating a canna for so long, loves it. You know, my other dog's been doing totally fine. So why do I need to switch? Because the link exists, we know that for sure. And why would you want to put your dog at that risk? They're still doing more studies, so hopefully within the next few years we'll know more information. Another common question, could I just add some grain in their diet? No, because it doesn't eliminate the risk. It has been shown to be something in the food itself. So I don't think the risk is high, but just because it exists, that's why it could be quite fatal. And this is a study they did. So these are all of the food brands that they saw. So they saw Acana being the most common one. So yeah, it's quite popular at some pet stores. So it's important that everybody is aware. Right, so now home cooked foods. So if you want to home cook your own food, it's okay, but you have to make sure it's completely balanced. So it's commonly they lack the right amount of all the nutrients and everything. So whenever someone wants to home cook food, I recommend this cookbook. It's Hillary's Blend. It's a bunch of recipes and it has a supplement with it. So I would recommend that just so you know that it's fully balanced. Or if they just want to home cook and, you know, just like that, that's fine. You could just mix in some kibble like from another brand like Royal Canine or something, and that's fine. But I still wouldn't do it in puppies because they're still growing. So now we're going on to toxicities. So dogs are toxic to a lot of things. So obviously there are more, but I just spoke about the main ones. And I'm sure most of you are already aware of this. So number one, chocolate. I'm sure you all know. That's a big one. So in chocolate in small doses, we could see vomiting, diarrhea. If it's a high amount, then we could see cardiovascular, like arrhythmias, and neurological effects. So sometimes they could start having seizures. So the worst chocolates are baking chocolate and dark chocolate. And then milk chocolate and white chocolate being a bit less. But it's important that you call your vet because there's a chocolate calculator. So they could tell you if it's something to worry about. And then obviously, you bring them in, and yeah, but that's important. So then avocados. So some dogs have a hypersensitivity to it and they're just allergic to it. So don't give avocados. Coffee also. Onions, garlic, and leek. So for dogs in high amounts, it can cause an anemia and they can have an upset stomach. And grapes and raisins. So every dog has a different threshold of what's toxic to their kidneys. And this causes acute kidney failure. So we don't actually know for sure what the toxic dose of a raisin or a grape is. So best not to give it all. Obviously, if you have a big Rottweiler compared to a little poodle and they each eat one grape, I'm not, for the big dog, I'm more worried for the poodle, because that's for the miniature poodle, because that's but we don't know the right amounts. So I would always bring them in and make them I would do vomiting, because it's quite serious. Macadamia nuts, and then artificial sweetener, so xylitol, that could be in any candy, chewing gum, toothpaste. So this can cause a low blood sugar. It's very serious. Has a fast onset. So you could see signs, it can happen within 30 minutes. So you want to, bring your dog in right away. And they can also affect the liver. So that's important. Marijuana. So marijuana is rarely fatal. But you can see dramatic effects. So you could see they may not have control of their bladder. You'll see they'll be very ataxic. So they'll walk kind of like they're drunk. A low heart rate. They're hyper responsive. So if you put your hand in front of their face, they'll freak out because the THC is toxic. But it still can be fatal at high doses. So it's still important to bring your dog in and be very aware of that. But recently, people have been interested in CBD oils for dogs. We know in humans, it helps with arthritis, it helps with pain, it helps with anxiety, but we don't have any long-term studies for dogs. So people are starting to do CBD oils. As a veterinarian, I can't give advice on this. I don't advise it just because we don't know the long-term effects. However, some owners do want to try it. So I always say, make sure it's a reputable place where you get it from. And I would do, it would be a good idea to do routine blood work on these patients, especially because we don't know much information about it. But yeah, obviously can't contain THC. So that's that. And any fatty foods, meats or treats. So if you want to give them a bit of cheese, chicken thighs, stuff like that. Any fatty foods can cause a bit of an upset stomach also. But sometimes when you give them a lot of fat at one shot, it could cause an overwhelming response for the pancreas because they release enzymes that digest the fat. And the whole pancreas could become very, very inflamed, and your dog could look very, very sick with vomiting, diarrhea. So don't give them too many treats at one go or fat in one go. And throughout the day, if you give your dog a treat, it shouldn't exceed 10% of their full daily diet. So you want to keep it a bit minimal. And then, yeah, Tylenol, so paracetamol, acetaminophen, higher doses, and then rat poison. So that's very, very serious rat poison. Especially when you're moving to a new place, you're moving houses, there could be rat poison in the basement, in the garage. So you always have to check, especially when you're moving, but that's very serious. And then tobacco, so cigarettes, and then anytime you change your dog's food, it could cause a bit of an upset stomach. So you want to do it slowly. You want to do a slow food transition over about a week. So day one, maybe incorporate just a few kibbles. Day two, a bit more until you fully swap them over onto their new diet. So now what? So you're at home, you have a chocolate bar, your dog eats it. Oh my God, what do you do? So call the vet right away, see if you can calculate the dose. If it's within 3 or 4 hours when they ate it, go to your clinic right away. It's always better to bring them to the clinic and induce vomiting there. If for any reason you're not able to go to a clinic, you're at home, you can't get there, you can give 3% hydrogen peroxide. But there is always a risk of esophageal or gastric ulceration. So, you know, it's kind of a last resort, but you don't want to end up, if you don't have to, potentially with a second problem on top of the first problem, if you don't have to do that. If you see any clinical signs of toxicity, so if you already see vomiting or neurological signs, do not give hydrogen peroxide. It could cause aspiration pneumonia and they'll have no control, so it could be quite serious. Okay, so now we're moving on to prevention. So what is prevention? So basically it's flea and tick and heartworm control. So is it necessary? Yes. You can have flea infestations at home, can be very difficult to get rid of. And also your dog can get tick-borne diseases that could be lifelong. And recently, especially in these areas, we've seen a lot of more ticks in the city areas and dogs with ticks, especially the last summer. So the tick can carry Lyme disease, and it must feed and attach to the dog for at least 24 hours before the bacteria is transmitted. So that's why it's also important to do body checks on your dog, especially if you know, like you're going on a hike or something, it's important to do body checks. And if you do find a tick, don't just yank it off with tweezers or something. You want to buy special tick removers because if you pull it off with tweezers, the head could still stay stuck there. So it's important you know the right way to remove it. And if you find a tick on your dog, you want to test for Lyme disease. It's a SNAP test. It's called a SNAP 40X. It's just a little blood test 6 weeks later after you find the tick. So what are tick-borne diseases? So in Canada, it's Lyme disease, and there have been a few cases of anaplasmosis. I'm not going to go into what it is, but it's quite severe. And then also in the States. So a lot of people, they go to Florida, they bring their dogs with them to Florida. There are way more tick-borne diseases there. So in the States, you know, we have Lyme, Ehrlichia, anaplasmosis, babesia, Rocky Mountain spotted fever. They just can cause serious, serious problems. So especially if you're going to Florida or somewhere hot, you want to get your dog on tick prevention, even in the winter. So Lyme disease. So what is Lyme disease? It's caused by the bacteria Borrelia burgdorferi. It's transferred to dogs through bite of an infected tick. So up to 10% of dogs with Lyme disease will show clinical signs at some point. So that's a very small, portion of dogs. If they have Lyme disease, if they have an infection of Lyme disease, only 10% are going to show clinical signs throughout their life. And what are those clinical signs? So they have painful joints. So we may see shifting lameness, meaning one day they're going to be limping on their front left paw. It's going to be a few days, go away. 2 weeks later, you're going to see them limping on their back right paw. And then we could also see that the kidneys being affected. So we may see urinary issues. They may be lethargic. They may have a fever. So also very vague clinical signs. And then if it goes to severe infection, it can cause cardiac and neurological signs. But this can be prevented with monthly tablets and the vaccine. So I just have a picture of how the tick looks. So, a few days later, it gets really, really big, could be quite nasty. People can get mixed up with like a little skin tag or a lump. So it looks like that. So fleas. So fleas are very difficult to eliminate from your house. They can be extremely itchy and cause restlessness behavior. And some fleas are allergic to them. So some have something called flea allergic dermatitis. They react to the flea saliva. Their lower back will get very, very, very itchy. They'll have skin sores and scabs. If severe, they can become anemic. And they'll very contagious. So they'll go to the other animals in your household. And the eggs can stay in the environment for a very long time. So it's important, your dog is on flea control, and if they do have fleas, you have to treat your environment as well. So you have to spray insect growth regulators, you have to vacuum, wash the bed, hot water, all that. And then heartworm. So heartworm is a parasite that affects the heart. It could affect the lungs as well. It's carried by mosquitoes. So in the summer, the mosquitoes come out. Some of them can have heartworm and infect the dogs. It starts with the infected larvae. So it could take up to 6 or 7 months for the adult worms to form. So you may not see any clinical signs for a year or two, even after your dog has heartworm. It's not that common, but it's very, very possible. So it could be severe. We could see weight loss, coughing, exercise intolerance, fever, and fatal at high infestations. So we want to get them on heartworm control. We want to get them on HeartGuard or Simparica Trio or NexGard Spectra. We want to treat them for heartworm from June to November. So those are the months when the mosquitoes are out that we want to go to. So SNAP4Dx, the blood test, what is it? So it's a little blood test. We know the results right away, very fast. It tests for Lyme disease, Ehrlichia, anaplasmosis, and heartworm. We're not worried about Ehrlichia here. Ehrlichia is not in Canada. But what happens if your dog tests positive for Lyme disease on the SNAP test? It means your dog has been exposed to Lyme disease. It doesn't necessarily mean your dog has an active infection. Because 90% of them, they'll be fine. They won't show any clinical signs. So this is, vets have different views on this. Some vets recommend, I like to recommend, it's doing a special antibody test. So it's called QuantC6. It basically tests the level of antibody. And if it's high, some vets treat for a month. Also, it's good to check the urine as well to see if there's any evidence of kidney disease. And if the SNAP test is positive, if the dog is clinical, I always treat. There's no point in doing further testing. But usually antibiotics are for a month, and they will treat it. And also, if the heartworm is positive on the SNAP test, if the dog has heartworm, and we give them heartworm prevention, it could be quite serious, because it will cause all the adult worms to die, and it could be quite serious. But luckily, heartworm isn't common, that common. So prevention, so what are the medications? So there's Simparica, there's NexGard, there's Bravecto. Those top three are oral pills. Simparica and NexGard are monthly pills. Bravecto is every 3 months. And there's Revolution Plus, that's topical. So I like Simparica and NexGard. I think they're the best ones. At my clinic, we just tend to use Simparica. So they're effective at killing adult fleas and preventing eggs from hatching, and they'll kill ticks as well. So they're very effective. They're given monthly. We like to start in March and we go until November or December. It really depends on the temperature outside. Reactions to these medications are extremely rare. They're very safe. Usually maybe a bit of vomiting or a bit of nausea, but rarely they could have seizures, diarrhea, or skin reactions, but it's very rare. So the benefits outweigh the negative effects. All right, so spay and neuter. When do we want to do this? What is it? What's the best time? We hear a lot of different things about when the best time is. So basically spaying and neutering your dog are their surgical procedures to prevent reproduction. So in the females, we remove the ovaries and the uterus. In the males, we remove their testicles. So why do we do this? So for female dog benefits, it really, really reduces the risk of mammary carcinoma if done before the first or second heat. So the dog's period, if it's done before the first or second one. It also eliminates the risk of uterine cancer, and dogs tend, when they get older, especially a few months after their heat, sometimes they develop an infection of the uterus called pyometra, and it could be quite serious. They need surgery right away. So obviously by spaying them, we'll eliminate this. And obviously it will eliminate behavioral changes associated with being in heat and, in the house, you won't have like the bloody discharge. So for male dog benefits, it eliminates the risk of testicular cancer. It also prevents against benign prostatic hyperplasia. So basically it's just benign growth of the prostate gland, not cancer. It just kind of grows and gets bigger. But it can be quite severe and it could interfere with urinating and defecating. So best to just castrate. Behavioral issues too. So behavioral issues, it's proven to help with inter-male aggression. So aggression with other male dogs. And also it helps with marking behaviors, urinating a lot, urinating in the house, stuff like that. So what's the best age? So a lot of people have different views. There's not one right answer. It's just every vet has their preference and their beliefs. There's not one right time to do it. It really depends on the breed, the size of the dog, and the type of dog and the lifestyle. So personally, I like to follow the American Animal Hospital Association's recommendations. So what they recommend to do is for small breed dogs, so meaning their target adult weight will be less than 45 pounds, they should be spayed before their first heat, so at around 6 months. For larger breed dogs, if their adult weight is going to be over 45 pounds, it's best to wait for after their first heat. This will allow complete maturity of the growth of the joints because it takes longer for larger breed dogs to grow. And also their heat is later as well. So the joints will be more stable and we could spay them later up to 15 months, really depends on the size of the dog. And this has shown to reduce the risk of cranial cruciate rupture. So it's like the ligament in the knee, similar to like ACL rupture in humans, but it could be quite serious. Reduces hip dysplasia, osteoarthritis, and even some cancers. Therefore, it's important to consult with your vet to see what type of dog you have, to go over the risks and the benefits of what's the best age. Now, so facts. So what are the actual facts? So mammary carcinoma is one of the most common tumors in female dogs. So 50% of the time it is malignant. So it's serious. If we spay before the first heat, the risk of developing it is 0.5% chance. After the first heat is 8% chance. After the second heat, it's 26. So we really want to keep it either after the first heat, before the second, or before the first. And after that, it stays 26. But yeah, if you see the picture, it could look like that. So it is easy to miss sometimes. So at home, so that's what it would look like on the dog's belly. So early neutering. So what if you, let's say you have a Rottweiler or German Shepherd, and you neuter them really early, let's say 5 or 6 months. So what can happen? So it makes them more prone to hip dysplasia, so deformity of the hip joint during growth, which can predispose to arthritis later on in life. And it's also a greater risk of getting that cranial cruciate rupture of the knee, which they'll be limping, they'll be in serious pain, and it's very expensive. Usually they need surgery. It's very expensive. So especially in Rottweilers, it's important to wait at least 1 year of age, because they saw that there's a significant reduction in osteosarcoma, which is a bone cancer. So it will increase the risk by 3 to 4 times more likely if you neuter them early on. Also, golden retrievers as well, they saw it does help with some cancers, so they want to wait till at least a year in Goldens. So if you or the owner sees behavioral issues, so let's say your dog is humping excessively, or you see signs of aggression, always try and work on it with a behavioral therapist first. But if it doesn't work, then it might be worth considering neutering earlier on. So yeah. So now we're moving on to actual, an issue, a problem. So I'd say out of a lot of cases I see at the clinic, I'd say this is one of the top ones. A lot of skin issues. So this is just very, very common. So it's skin allergies. That's the most one of the most common things that I see. And what is it? So it's the hallmark of allergies are pruritus. So meaning their skin gets very, very, very itchy. So is your dog licking, rubbing, chewing, or constantly biting their paws, rolling around in the carpet, cleaning themselves, scooting, so rubbing their bum along the floor, head shaking, or just grumpy, very irritable? So no, these are not normal dog things. Can be, but usually it's not. So allergens. So there are different things of allergens that your dog could be allergic to. It could be food, it could be environmental, including human dander, dust mites, outdoor pollens, grass. So I really like this picture because it kind of shows if your dog does have allergies, what spots are going to be the most affected, where they're going to be the most itchy. So a lot of the time it's the ears, around the face, paws a lot, sometimes the groin, the armpit, and sometimes like around the bum as well. And this is a picture of a dog who has allergies. The paws are quite affected. So you'll see they're very red, they're very inflamed, they're just itchy. So that's the typical distribution where they get itchy. So allergy, what does it mean to have an allergy? So we have different categories. So I mentioned the flea allergic dermatitis earlier. That's usually in the lower back. There's food hypersensitivity. So some dogs are allergic to food. Usually, like I said before, beef or chicken. And I think around 50% of the time, you will see other signs when they have a food allergy. They might have diarrhea. You might always hear stomach noises, like just bubbles in the stomach, just making noise. They might be going to the bathroom multiple times, and also they may have anal gland issues. So yeah, dogs have anal glands. They get released when they go to the bathroom. They kind of put a scent on their feces. Sometimes they get blocked. You'll see the dog constantly licking their bum. So if you see the dog's itchy and has that, it might have a food allergy. Usually, if they do have a food allergy, you'll see signs before 1 year of age. And then there's atopic dermatitis, extremely common. Usually it's environmental, and it's also a bit of an interplay between a defective skin barrier and something they're having a hypersensitive reaction to something in the environment. So it's similar to eczema in humans, but 30% of dogs with atopic dermatitis will also react to a food as well. There'll be a food allergy component as well. So it could be a bit of both too. Usually you'll see by 3 years, they'll be itchy, but also with atopic dermatitis, with allergies, you could also see much later on in life as well. Doesn't necessarily mean it has to be before 3, but usually it is. So what do you do if your dog's itchy? So always start with weekly baths. Try and get the allergen off your dog. Wipe their feet after going outside. Fish oil could actually help with the skin barrier. So I like Icosderm liquid. There's no side effects of giving it. It only has good things, so you could always try that. It might help a bit. And these are all easily done, so you could always start and try that. And obviously we want to make sure they're just covered for fleas, because it's so easy to just treat and give them the tablet. So we want to check for that. And yeah, usually when I see them at the clinic, if they have allergies, it's usually for a secondary infection. So because they're so itchy, they're constantly licking and scratching, I usually see them for already an infection. So that's why it's important that owners are aware and they can notice these signs earlier and kind of get it under control earlier before it kind of progresses to its actual skin infection. So yeah, so I always like to start with a food trial first before relying on medication, because if we find out it's food, they'll just be on the food for the rest of their life and we won't have to rely on medication. And in the long run, it's cheaper too. So if we want to do a food trial, we could do a novel protein. So we could try like a salmon-based diet, especially puppies. A lot of the prescription diets, they're meant for adult dogs. So that might be a good option for puppies. For adults, we have Royal Canine hydrolyzed food, Purina HA, it's also hydrolyzed, and Hill ZD. The picture here is Hill ZD. So these are all hydrolyzed diets. So hydrolyzed diets, by that I mean the protein is broken down to such small pieces, small amounts that their body doesn't react to it. So those are great diets. Or you could try home cooking with a new protein like white fish or something as well. But if you're going to do a diet trial, it has to be it could take 8 weeks to see an improvement. So it could take a while. So you have to be patient, and they can't eat any other foods. So they can't be eating little bits and pieces from your plate or things like that. It has to be strictly that food. So yeah, and let's say the dog is really severe. I don't just send it home with the food and say, oh, let's see in 2 months. Yeah, I give medication, then around the 7-week point, I wean them off the medication, and then we'll see if they're still itchy, then it might not be the food. So I always like to try that first. And then so atopic dermatitis. So how do we even diagnose it? So we base it off of clinical signs. There's no test that will tell you. So I like this chart because it has just the things, if your dog has 5 or more, then it's basically atopic dermatitis. So, if it affects the ears, if they're itchy around their ears, their front feet, they're less than 3 years old, they get chronic yeast infections, and if they respond to medication, so if they respond to steroids, then we kind of know it's that. Mostly indoor lifestyle. So there is some talk about, maybe if you take your dog outside, expose him to all these things when he's young, maybe it'll help prevent your dog from developing this. So early exposure is good. Non-affected dorsolateral area, because that would mean it's could be fleas. And pruritus without skin lesions. So if you just see if they're itchy, so the skin might be a bit red. And 48, I just found this interesting, 48% of the time, it actually affects the owner's quality of life, because they're either sad for their dog, it's a lot of money to do all these trials and things. And it also can have a big impact on the dog's behavior. So the dog might be aggressive just because they're so frustrated because they're so itchy all the time. And that's a picture just of a French bulldog. They're they have a lot of allergies. So you see the eyes, they're all swollen, the muzzle, it's all red. Even the ears are a bit red as well. So ears. So I also see a lot of this too. Yeah, he always gets ear infections. So allergies can sometimes present with just affecting the ears, just ear infections. So it's important we always treat the infection, but if we see it keeps coming back, we may want to think about maybe trying allergy medication options or food trial, and because we want to treat the primary problem. We want to figure out why this keeps happening. Dogs just don't get ear infections. There's always a reason why they get the ear infection, whether it's due to allergies, whether there's a foreign body. Some dogs have very hairy ears, so they're prone to wax and accumulation. So in some small dogs, when they get very, very hairy ears, you could even slowly just pull it out and routinely clean their ears. Also the conformation. So if you have a beagle or a golden retriever with floppy ears, it's going to be a high moisture area. It might be worth cleaning their ears every few weeks or something, or every week. Polyps too, just like skin growths and things can predispose, and swimming. After swimming, if your dog's a swimmer, you really want to clean their ears and dry it out. And this is a cleaner I like. So it's Triz EDTA. It's just a great cleaner. It's important to clean their ears properly though. So, you know, you could ask, when you go to the vet clinic, you could ask them to give you a demo, but you really want to massage it in there and really clean it out. Yeah, and also long-term, it can cause calcification. Their ears can become so thick over time, and making it really difficult to treat. They can, you know, have resistant ear infections. So it's important. We kind of want to like nip it in the bud early, just get it under control. So if, you know, you always see your dog having ear infections, it might be worth trying alternative therapies. So yeah, so atopic dermatitis. So we're never, well, not say never, but we're not trying to cure the disease. We're not trying to get rid of it. We're just trying to manage it. We just want to control the clinical signs. Even if we reduce it by a little bit, can make a big difference. So, you know, there is allergy testing. It's called intradermal allergy testing. So the purpose of that is basically to see what they react to. Sometimes they could formulate a special vaccine with the allergens, and then they could do immunotherapy. So they could introduce it and inject it into your dog, try to desensitize him. That's the only thing that will actually bring down the allergies, but it only works 65% of the time, and it's really expensive. So we don't tend to really go down that route, and that would have to be with a dermatologist. So we tend to just try and control it with other alternatives. So medication trials. So prednisone. So especially if your dog reacts. So prednisone is a steroid. It helps with the itchiness, the inflammation. Very, very good for that. Short term, it's okay. Long term, it could have bad effects. We don't want to rely on this long term, but short term, it could really alleviate their symptoms, especially with the inflammation. So, and then once we get that under control, what could we use long term to control it? So we have Apoquel and Cytopoint. Those are, they both block the scratching pathway. They work very well. They each work about 70% of the time. They're a bit different, but they work in a similar way. So Apoquel is a daily pill. Cytopoint's a monthly injection. So it really depends on, you know, what kind of dog you have. If you can't pill your dog every day, you might want to go with the Cytopoint. And yeah, we could do like a month trial of each and see if they work. Cytopoint acts more specifically, so there's 0 side effects. Cytopoint's very, very safe, literally no side effects. Apoquel, very unlikely to have side effects as well. So they're both great options. May not reduce it completely, but even by 50% can make a big difference. And also some dogs we see get worse in the summer. It's seasonal, so only need to be on it seasonal. And yeah, so thank you very much. I hope you guys found this useful, and I'm happy to answer any questions if you have any.
Thank you, Joanna. If anyone has questions, you can either raise your hand physically, raise the reaction hand, or put it in the chat. Oh, we have one question from Vicky Shemi. Any chance please jump from humans to humans from a dog?
For ticks?
Fleas, she said.
Oh, flea. Yeah. So fleas could jump to humans, but they don't, the humans aren't the host. So they don't stay on the human. Sometimes you may see like a little bit of like a red bump, but it'll just go away. They don't stay on humans. But they could definitely go on humans for just a second. But yeah, they don't live there. So you don't have to worry
Sandra
about that.
Suissa Maghrabi asked, what about wet food?
For yeah, wet food is fine. You could also combine wet food with dry food. That's totally fine. Wet food tends to be more caloric, so it's important to make sure you're giving the right calories. But yeah, I like to mix the two. Also, if your dog, you know, just had a dental and doesn't have many teeth left, wet food may be the way to go. Or if your dog's older and has issues and needs a specific diet, that's fine. But yeah, wet food's fine as well.
And she's also asking, what's an ideal amount of daily exercise?
Yeah, so it really depends on the type of dog you have. Obviously, if you have like a, you know, golden doodle, golden retriever, husky, they need a lot of exercise. So you could take them out, I don't know, 3 or 4 times a day for half an hour. But if you have a small dog, they need less. Obviously, in the winter, they might not want to go out. That's fine. So you could exercise them in the house.
Albina has a question. Fixing male cockapoo, is that time sensitive like a female? At what age is preferred?
Cockapoo. So it depends on the weight. Yeah, I'd say if he's a small dog, you could do it at 7 months. That's fine. But obviously, if he's a big cockapoo, you could wait till 10 months. But it really depends on his adult weight.
We have a question from Marina Mashal.
Mhm.
How does a dog get allergic to chicken or beef to begin with if they are meat eaters? Must one be careful with fish treats because it's so fatty? And when you go to a pet store, they are so anti-vet food. So how do you trust things?
Yeah, so pet stores, very different views. Obviously, you know, we base it off of facts. So that's that. And for fish treats, so you can give fish treats in small moderation. I wouldn't give all at once a bunch of fish treats, but yeah, just a few is okay. And if they have a chicken or beef allergy, it doesn't necessarily mean they're going to start getting itchy right away, right when they're born, right when you feed them. Fit like chicken or beef, it's a hypersensitivity, so it can get worse over time, and that's why they may only show signs at, I don't know, 10 months of age. And even with allergies, it can get worse over time. So even if you have a dog that's being treated on a chicken or beef or even another type of allergy, if they all of a sudden stop responding to their treatment, it might just be because the allergy can get worse over time.
Rosie Sharabani, unmute yourself.
Hi, Joanna.
Hi, how are you?
I want to let everybody know that Joanna is my vet, and I'm very excited. So,
yeah, I love Sunny. He's great.
so 2 questions. One, you talked about neutering, and I think you said because we're waiting for 1 year of age, and he's below 45 pounds. Did you say it has?
Oh, yeah. So it's their adult target weight. So how it depends on the size of the parents and how big is he now? How much does he weigh?
35 pounds, and his maximum is going to be about 38.
38. So yeah, so you could do it. How old is he right now? He's how many months?
He's 9 months.
He's 9
months, yeah.
Yeah, so you could do it. I would say it not. You could even do it now or at 10 months. But yeah, there's no harm in waiting. You could wait another month. That's fine.
Second question is what Marina brought up. Like the stores are adamant again.
I know it's a big problem.
And they completely convinced us otherwise. Like they steer us away from I think the Royal Canine is what.
Yeah, they have problems with Royal Canine because the ingredients, you know, they're fillers, they're byproducts, but those are actually proven to be very healthy and a good source of nutrition. They're just leaning towards that because I guess based off of humans, but they don't know that it's related to that. And they even believe that, oh, it's not true. But yeah, I've actually shadowed a cardiologist for a while and I've actually seen it myself. So I really think that there should be more awareness about it. There really should be.
The Royal Canine.
Yeah, Royal Canine, that's good. Yeah.
Okay.
But a bit about like the grain-free, like, those, the boutique foods, there should be more awareness about it. It's just really understudied. So yeah.
Thanks, Joanna. Thank you so much.
Yeah, I hope that answered your question.
We have a few in the chat.
Mhm.
We'll start with Viola. My dog
Yeah.
has seasonal allergies. Pills and shots don't work. Any other remedies to suggest?
Yeah, so there are multiple medications. I didn't list all of them, but it really depends what medication her dog's been getting. So definitely there is prednisone that tends to work almost like 100% of the time, but it's not good long term or in older dogs really, or if the dog also has an underlying condition or a heart issue. But if the dog's healthy, I mean, I think it's okay to just give it very short term. That's totally fine. But long term, I wouldn't give it for like the whole summer. So I would definitely try either Apoquel or Cytopoint. Some owners' dogs have it so bad that we actually have to combine Apoquel and Cytopoint. And if those don't work, there is cyclosporin as well. It is safer long term, but it does take a good month or two to actually start working. So it really depends on her dog's history and what the dog had and the dose of what the dog had as well. So she should definitely consult with her vet to try and see what she's had, what she hasn't tried, and if she could potentially up the dose of something she's had. And she could try all the stuff like wiping the paws after walks. She could try the omega-3s, try weekly baths, and yeah, see
Thank
if
you.
that works.
Viola, does that answer your question? Yes, he said thank you.
Yeah.
Vicky Shemi would like to
Mhm.
know, she doesn't have a dog. She'd like to know where's a good place to buy or adopt a dog.
To buy, yeah, definitely from a breeder. And you also want to know the parent's history. So you want to have record, you ideally want to meet the parents when you go visit the dog. You just want to make sure they're reputable. So you could check like their resources and stuff, and make sure that their parents were healthy, that they didn't have any, genetic predispositions or stuff like that. So yeah, look into that.
Thank you. Sandra Mograbi would like you to put back the chart with food brands, with Acana being most toxic.
Yeah, sure.
This is the one that you
Yeah.
that
That's
you
the one in
recommend?
the study that they
No.
did in 2019.
Okay, and where's the one that you recommended? There were
Oh, with my recommendations. Yeah, so I really like, I could just go over the diets I like. So Royal Canine's great. I love the dental diet, especially in small breed dogs. They're prone to a lot of tartar and dental disease. So obviously brushing the teeth every day is important. That's better than doing, any chews or the food. But the dental diet's great. The Royal Canine dental diet's great for adult dogs. If you have a puppy, Royal Canine development is good. That's from the vet clinics. You could also just go to Mondu and buy Royal Canine puppy. That's totally fine too. Hills is another good breed. So they do have a lot of prescription diets for dogs with conditions, like when they get older and stuff. But the science diet's really good. I really like that one. Hills also has a dental diet. It's called TD, but based on my experience, I think they prefer the Royal Canine dental diet. I think it's tastier. Not that I've tried it, but yeah. And then Purina. So there's Pro Plan for puppies. That's a good one. I think they have an adult Pro Plan as well. And then the Purina Essential Care line is really good. Like dogs love it. That's a great food. Also, I think for cats too, there's Essential Care. That's really good too. They really like it.
Thank you. Does anybody else have, oh, she has another question, Sandra. The brands you recommend, are they less caloric than what the stores recommend?
No, each bag is different. Like the one that the stores recommend, they probably also have a higher protein in them as well. It really depends on how much the dog weighs. So I always body condition score and see if they're underweight, overweight. So I take that into consideration when I calculate how much food they should be eating. And then I always look, like each bag is different. So they just have to be eating the right amount. Obviously there are diets for weight loss and stuff, but if we take their, their weight, if they need to gain or lose weight, and check the calories on the back of the bag. I always, when owners ask, I always calculate how many cups they should be eating per day for their needs. So you could ask your vet to do that. There is a calculation for that about how much they need.
Okay, Linda has a question. Go ahead.
I just wanted to know how often you can bathe a Shih Tzu. And he has allergies, and I'd like to know how far can you push away surgery for a cherry eye?
Oh yeah, so for cherry eye, that's the only treatment. In the meantime, you could apply lube in the eye, but you kind of want to do it right away. It's, I mean, it'll stay like that. But obviously, if they have the cherry eye out, for all of you that don't know, it's just a prolapsed gland, like the lacrimal gland of the eye. So it'll just constantly rub against like the sclera of the eye. So if you leave it out, I mean, they're just more prone to like ulcers and things because it'll constantly like the rubbing. So I would just put lube every day up until you have that surgery. And with regard to the bathing, so in the summer, like when his allergies are worse, I would bathe. You could do once a week, but I wouldn't do more than, and you could try and get down to every 2 weeks because you don't want to bathe them too much as well because it can cause dry skin. So yeah, I would do that every 2 weeks, see if it's enough.
Thank you.
Thank you. If there aren't any questions, Joanna, thank you for an amazing evening. Very informative. I learned a lot. I might have to change my dog's diet now. Everybody, we encourage donations in honor of Joanna. You did an amazing job. I'm going to ask everyone to unmute yourselves and thank you, Joanna.
Yeah, I hope you all found it useful.
Thank you so much, Joanna. Thank
Thanks
you.
for having me.
Thank you.
Perfect. Thanks, guys.
Thank you very much.
Yeah, no problem.
It was a really very informative. I learned a
Yeah,
lot.
I hope I wanted to cover the most common things. So I hope it was useful with that.
Mhm. If anybody wants to put their dogs in the video, we'd love to see them.
Yeah, show your dogs.
Yeah, everybody go turn on your videos and show us your dogs.
I wish I had a dog, but I don't.
Oh, they're all so cute. I love it. Adorable.
That's Lola.
So cute.
That's so funny.
Oh, who's that? Who's that? Hi, doggy. Lola doggy. Hi. Oh, they're all cute.
They're all so adorable.
They're adorable.
You know Molly, Joanna. Here's Molly.
Oh yeah, Molly. Oh, I miss Molly. She's so cute.
Lola, kiss.
She's so cute. Thanks so much for having me.